FM. So we've got another fantastic show today, another tantalizing show. It's as always, we've had this is the fourth week actually coming into Ramadan, and we've had some fantastic speakers in the last 3 weeks, and we've got nothing less today, and we've got a very interesting topic, and it's basically going to be on leadership, not just leadership as leadership per se, but trying to understand some of the art, the science, the psychology, the styles behind leadership. Now, before I introduce my guest, we would like you to interact. Call in, send us text messages. You can see us live stream on Facebook, etc. We're on YouTube. Just go to our website and you'll get all the information. Now, to call in, you can ring the number 0116 4822 086, or you can text us on the number 0774 8855 That's 0774 8855. Or alternatively, you may email us on info@ramadan.fm. So okay, so without any further ado, I am going to introduce my guest today. Now, while we do that, before I introduce, Ty, can you just switch off your other device, because I think we're getting an echo. So if you just turn, that's better, I think. Right, so we've got Dr. Itai Matumbike, who is a consultant forensic psychiatrist and an executive medical director working for Northamptonshire Healthcare NHS Foundation Trust. Itai is a member of the Royal College of Psychiatrists. He was born and graduated in Zimbabwe. After completing his studies, his basic medical education and his house job, he came to the United Kingdom in 2002. He was trained both in Nottingham by completing initially his Masters of Medical Sciences in Clinical Psychiatry with Nottingham University, and also completed his MRC Psych, as we call it, membership of the Royal College of Psychiatrists, by the Royal College of Psychiatrists. He then trained himself to become a forensic psychiatrist and subsequently a consultant in 2011. And the story doesn't stop there. He didn't just become a consultant forensic psychiatrist. He took a deep interest and a keen interest in medical management, which is basically one of the top leadership roles in organizations. He was the associate medical director in 2017 in Nottingham, and then became the interim medical director in 2019, before becoming the executive medical director in Northamptonshire Healthcare NHS Foundation Trust. And I'm proud to say that it's in the same trust that I work in. He's been working with us since October 2020, and it's been a joy, a lot of fun, and a pleasure to have him part of our organization. As part of his extracurricular activities, Itai does a lot of work and has done a lot of work locally, nationally, and internationally, promoting the COVID-19 vaccine via webinars, as would be the case during this difficult pandemic. And to top it all off, and one of the best things I like about Itai is that he's an Arsenal supporter. So fantastic. Itai, a big welcome to you.
Thank you very much. That's a very generous introduction there, Shahid. But yeah, thank you very much. It's good to be here, and thank you for having me.
It's a pleasure to have you, Itai. And I love, you might not be able to see us, but we can see you, and I love the background that you have. So when I do share the link with you, you'll be able to see yourself with a beautiful, springish, if you like, background. That's really nice to
Yeah,
have.
it's actually interesting. People always say it's spring. It's actually autumn colors. It's my favorite hole at the local golf course.
Mm.
So you've got the weeping willow there,
Oh, wow.
in the sunset. So it's just one of those pictures that reminds me of one of my favorite things. When I want to unwind, I usually play a round of golf, and the quietness and the stillness actually, and the closeness to nature, makes me relax and yeah, re refresh.
It's interesting you should say that, because those are, I'm sure, some of the things that you will be discussing as a medical director, as a leader in your profession, about the importance of work, rest, and play. I'm sure we're going to be touching that part of it as opposed to just leadership and proactive working. Just take us through, I know I've given an introduction, Itai, so just give us a little understanding. I mean, you know, you've been in the country, in the UK, a little under 20 years, and you've achieved so much in such a short period of time. And, you know, it's a joy, it really is a joy to see someone coming from another country and within a span of less than 20 years, reaching the top or the pinnacle of you know, the post in their profession. You may not see it that way. You may have other avenues in the future to gain beyond this. I'm sure you will, knowing you. But tell us, give us a little flavor about Itai. What's happened? What you've really done? What's the secret behind that?
Well, there's no secret really, but actually, interesting you say. You know, I've been in the country for over 20 years now. But when I first came to the country, my desire and ambition was merely just to get a doctor job. And so some people who've kind of had a similar sort of international medical graduate experience will know that you have to, apart from having your qualifications from your home country, you'd have to get registration in the United Kingdom, and for that you need to go through PLAB exams, and then it's quite a process to actually try and get yourself registered with the GMC. You know, because I was quite in awe of the practice of medicine in this country, I just to be part of it, just to work in the health service, was the initial driver for me. I think as as I got into it, and I got to have a bit of an understanding of how the health system worked, I developed a passion for quality improvement and trying to change things. And one of my views is that if you should always try and be the change that you want to see. If you find yourself in a position of influence, it's how you use that influence to improve things, which is the legacy that you want to leave behind. So that's the one thing that's kind of driven my passion for leadership. I think a lot of things happened along the way. I met some really good mentors who took an interest in what I was trying to do, and supported me through the journey that I've been on. I'm really grateful to have had the opportunities that I've had, and for me, it's about making full use of those opportunities to improve the health of the population. Really,
I love what you say there. Be the change you want to see. That's absolutely fantastic, and I often see you or hear you using that phrase, in various forums. And it's really, I suppose very simplistic, but it's very powerful, isn't it, for individuals to pick up? It's something I've certainly picked up from yourself. You've mentioned the word mentor. Now, knowing doctors, Itai, and probably you are, aware of that as well. You see doctors, people from healthcare professionals. I know we're both doctors, but I'm going to, extend it further to other professions, because although it's a health show and we are talking about doctors and leadership within the medicine, but for other viewers, because I know we've got other listeners who are not doctors, and so what people come in, and I'm going to use the example of doctors because that's where the environment that we work in, or healthcare professionals who highly qualified, do a fantastic job in running healthcare services. What does it take for individuals to look at the other aspect? You said be the change you want to see. So what is it that one has to do in order to achieve that? You've mentioned a mentor. I mean, I've certainly experienced that if you don't have a mentor and an appropriate mentor, it can drive you in different directions. So how important do you think, would you say to our listeners, that having the right mentor is important?
Well, I'd say it's absolutely vital. There are a number of things that you have to look at. So there's not everybody wants to get to the kind of top echelons of leadership. Some people are just driven by wanting to do a really good job as a clinician. And even for that, you do need somebody who can be a critical friend who can guide you along the way. And sort of tend to adopt a kind of coaching style to my leadership. And often there's a bit of confusion between what is mentorship and what is coaching. But for me, often, a mentor is somebody who's been there, done that, and worn the t-shirt. And then will have a similar kind of trade or specialty or profession as the person that they're trying to mentor, and then they therefore just guide them through their own experience and sort of make them aware of some of the pitfalls as that person navigates through their career. Now you can use a coaching style with that, and a coach doesn't necessarily have to be the same profession as you. And often, the coaches who aren't tend to ask you some of the really incisive questions that help you actually think and work out in your own mind what you're actually doing, what you're trying to achieve, and how you can achieve it. So my own coach was actually somebody who was a social anthropologist, and she helped me understand myself, in ways that I had never thought of before, and sort of unlocked quite a lot of, potential within myself to get higher. But it was the coach who helped me with my leadership. But it was other leaders, other medical directors, as I was starting my very first, the senior house officer job at Nottingham, who gave me that guidance and helped me sort of crystallize what I wanted to do with my own, career. And I think it was run about that time that I dared to dream, I actually realized that some of these things were possible. And it was really about, setting yourself on a path that would allow you to get to where you're trying to be. Um, and I considered my whole career as, all the things, all the projects that I got involved in, as opportunity to write my own CV. Um, and I think often, people, underestimate, um, the real advantage of, getting on and doing stuff. So often when people come to me and they say to me, "Oh, I want to get into leadership. I want to be this. I want to be that." I often say to them, it's not about the title. What do you want to do when you do that? What is it that you're trying to achieve when you get to a certain role? And if you can be clear in your own mind about what you want to achieve, then you can go very far. And leadership doesn't always have to be from the front. It can be from the ranks, and sometimes, a really really strong leadership from the ranks, affects change in a much more impactful way than people with titles.
Absolutely, Ty, you said it right. It doesn't have to be from the front, and I think this is something that individuals sometimes confuse with leadership. That anyone who's leading the pack is naturally a leader. They actually may be a poor leader,
Hmm.
and maybe someone who's just dominating rather than being a leader. So, and I suppose in your role, Itai,
Hmm.
in your role, it's for you to pick out and tease out what leadership you skills you see in individuals in people in within your team, and I'm sure every person has some form of leadership skills, and someone in your position, I suppose, has that responsibility to look out, man manage us. It's a bit like a football game of football, isn't it? That the
Absolutely.
coach, the manager has to know their team. They need to know their dressing room, and they need to know the
Mhm.
skills every person. And before you answer that question, we've got a message from someone who you may know. He's glad he's sort of come on and he's listening. His name is Dr. Hanif Sumro, and he's he's left a message. Good to see two great NHS leaders together. Thank you, Hanif, for those nice compliments. It's a pleasure that you're listening in. So yeah, so what's when it comes to leadership and recognition of your team, how important is that? Do you feel, Itai, in your experience?
So, when you think of a team, you have to think of a collective, of individuals who have got a common purpose. Um, and when a really strong team is only as strong as its weakest sort of member. So, what you have to do when you're leading such a team is to really understand what makes people tick and where people's strengths are and where people's weaknesses are. And you try and sort of accentuate their strengths and you try and help them to, navigate and cope with the things that they're not so effective at. And then there comes the whole bit about, placing people in the right spaces. So if somebody is really, really good at, analyzing and assimilating information, and you put them in a doing role where it's really quite mechanical and it's not as intellectually stimulating for them, they will get bored. And actually, when they start performing badly, it's almost the responsibility of the person who put them in that position by not actually recognizing what people's strengths are and not knowing where to place them. You'll find yourself, being quite ineffective as a collective. So one of the things, and you'll probably know this, that I've set about doing, when I joined NHFT was to really just have conversations with, all the medics in the
Mm.
trust. And so I offered people, one-to-ones with me from all grades, all specialties. And I got to sort of understand what, people were about, what their ambitions were, what their frustrations were, and what, they felt they could offer. And from having those conversations with various people, so I was sort of able to have a bit of an understanding of, how can we improve things? The other thing you always need to think about as a leader is that, not everyone who cries wolf is necessarily, saying, the right thing. But the more people you get to meet, and the more sort of perspectives you see about the same argument, you then start to understand what is the right way of tackling the challenge that you're confronted with. So I think knowing your people is part of being a great leader,
Mm.
and knowing how to sort of bring the best out of them, is part of good leadership and effective leadership.
Mm. How important is it for doctors to come into roles of leaderships, Itai?
Oh, it's hugely important. I think clinicians have got one thing that drives them, and particularly doctors. So when you train to become a doctor, um, you you spend about 5 years in medical school. It's hard work. It's a real slog. And when you come out on the other side, the one thing that drives you is really good outcomes for your patients. Now, often we underestimate, how powerful that is as a principle in leadership, because if you are driven by a desire, a real desire, to get really good clinical outcomes, some of, the wide-ranging decisions that you make, tend to have the patient at heart. Um, and I think whenever you've got, challenges, and there was a time that there were a huge financial pressures on the NHS. Well, those still exist. They haven't gone away, but I think there was a real great emphasis to on efficiency and that sort of thing. Um, Sometimes, some of the language that you heard did not necessarily reflect the real aims of the NHS, which was about, improving the general health of the population, regardless of, backgrounds, economic means, etc. Um, and I think a lot of clinicians really get that, because they when they're faced with a patient who has got a problem, whatever condition that is, what they want to do, is to prescribe a treatment that enables that person to get through. Um, so that for me is a real reason why clinicians, particularly doctors, should put themselves forward to get involved in those conversations. There's a lot of transformation going on in the NHS right now. And I would really urge doctors to be part of that conversation, because some of the, ways that, the intelligence that they have, the desire to get good clinical outcomes for patients, as well as, the training that they've got, can be very, very useful, in driving things forward. Remember, doctors, especially when you're specializing, you're trained to be, in critical analysis and, in research methodology and quality improvement methodology. All that is part of your specialist training. And usually those principles tend to be very, very relevant, in making key decisions about health. So some of those skills that I've gained as part of my specialist training and knowledge have really acquitted me well in my leadership role. And I think that's why it's important for doctors to be in leadership.
No, very well said. We will be coming to a break in just over 2 minutes. But just before we have these 2 minutes, and I'm going to come back to leadership styles and the art and a bit of science behind it, just for people to understand out there. Just before we do, we've got a little above 2 minutes. Itai, just tell us a little bit, how much do you enjoy being in the role of a leader?
If I'm being honest, it's got good days and bad days. I think when you are in really senior leadership positions, a lot of the simple solutions don't, or the simple problems are not put at your door. So somebody else has already solved that. It's when that person is struggling to get through a really complex situation that they bring those things to your table. And that can be a lot of pressure. That can be a lot of, you have to sometimes be wary of, the political impact of whatever decisions you made, however right or wrong they are. And sometimes having to make those really difficult choices can be quite challenging and stressful. But having said that, it's when things go right. It's when you have a massive win in terms of the experience of your staff and the experience of patients, and some of the things that you've been trying to improve come together. That's when that's the payoff. That's where I get the real buzz. Because there have been things, that even in the short time that I've been at NHFT, I've started to see some green shoots for some of the things that I was really quite keen to sort of get us to. And when that happens, that gives me a real,
Itai, just hold those thoughts there, because we're about to go to a break. So we're going to start off where we're stopped you there. And we're going to go for a short break and come back. You're listening to Ramadan Radio, 87.9 FM. We've got Dr. Itai Matumbuike, Medical Director in Northamptonshire Healthcare Foundation Trust. We'll take a short break. See you on the other side. Assalamu alaikum and welcome back to Ramadan Radio 87.9 FM. This is your host, Dr. Shahid Latif, and we've got another fantastic show. We've got Dr. Itai Matumbuke, who is the Medical Director working in Northamptonshire Healthcare NHS Foundation Trust. We've had some interesting discussions about leadership, the importance of leadership, the why it's important for people to come into positions of leadership, especially if they are working where it is highly required and their skills can be extremely relevant, and also the role of a leader in teasing out and picking up leaders within their pack. And like we say, everyone has their own strengths and weaknesses, and the role of the leader or the coach, the importance of it to tease that out. So keep your calls coming in. Any questions you have or any comments you want to make, give us a call on 0116 4822 086. Or if you want to text us, you can do that on 077 488 55055. Or you can email us on info@ramadan.fm. Or you can visit us on our YouTube channel. It's Ramadan Radio. We're on YouTube, we're on Facebook's live streaming as well. And if you don't have time right now, you can join us later on and have a look at the recording. So we will be there live right now and not live afterwards. So you can ask questions while we're here. Right, so Itai, just before the break, you were talking about how rewarding it is for people like yourself who are very motivated, self-motivated to make changes, wanting to be the change that you want to see, but also highlighting some of the challenges. One of the things you've said, and I really like that the way you put it, is, when things come to you, they're not easy things, because the easy things, solutions have been found. And when things are at an impasse or difficult, they land at your doorstep. And it's taking on, as a leader, how do you manage that pressure?
I think the best way to manage it is to expect it. Expect that people will, when the phone rings or an email comes through, someone wants to have a conversation, that, they are, finding certain things difficult. The other thing is to draw on your experience. So often, a complex situation has played out in a different scenario at some point. So experience comes into it. And also giving yourself time before you make a decision, because, just because someone has come to you and, there's an emergency, it doesn't mean that your reaction has to be immediate. Because often what happens is that, when you slow things down and you try and process things and you try and gather more information about stuff, the solution then reveals itself, through that process. Because sometimes when you make a knee-jerk reaction to something, you plug a hole here, and then, there's another hole that's gaping open next to it, and then there's another one, and then you realize that, maybe the solution that you use for one problem, created another problem elsewhere. And had you taken your time, to really analyze, the wider impact, of the thing that you're trying to solve, you might have created a solution that solves, that plugs both holes. So my view is that, take your time. If it's a holding position, which buys you time, always go for the holding position, and then sleep on it. Talk to other people, talk to more experienced people than yourself. Have a mentor. I actually have a mentor, as I speak to you now, someone who is not, from within the trust, someone who's been, arranged to be my mentor through the regional office. And that person is so far removed from what's actually going on internally, not invested in, the economic workings of our local ICS, and can have that panoramic view of what's going on. Because I'm in it and I'm involved in it, I find it difficult to sort of see the wood from the tree sometimes. But someone who's outside of it, has got that ability. So there are many different, avenues that you can use to arrive at the right decision. And sometimes just be comfortable with the fact that you might make the wrong decision. And when you do, be open and honest enough to say, hang on a minute, I got it wrong here. And I probably need to change the direction because of what's going on. And people have got a lot of time for leaders who are open and honest, because one of the things that people struggle with is trust. So if people can't trust you, and even if you've made decisions that they don't like, but if they can trust you and they know that when you are going to make a decision, you're going to be authentic about it, then that actually puts you in good stead. But
Mm.
yeah, for complicated situations, try and slow it down, have a holding position, and then think about what you're going to do. Think about the impact of whatever decision you make on the wider collective, and then make your decision based on, the path of least resistance, or the path that has got the least amount of casualties. Because when we get to the complicated decisions, they are going to be winners and losers either way.
Mm. So accept challenges, expect to make mistakes, and take stock and take your time. Soft skills required. Some powerful messages there from Dr. Itai Matumbike. Please call us in. Any questions for Itai, who's taken out his busy schedule to come on to us to share his experiences about leadership, not necessarily just in medical leadership, but leadership per se. Which takes me on to my next question, Itai. If you like, it's basically looking at different leadership styles. Does one size fit all?
No, one size does not fit all. I think one of the things that you need to do as a leader is to understand what your personality is, um, and then sort of try and build from there. Um, One of the things that I've always found really, really powerful is getting multi-source feedback. About your leadership style. If you work in the NHS, and you are able to get something called a healthcare leadership model 360, that ask some really incisive questions to the people who you work with. So your line managers, your peers, your direct reports, and the wider group of people that you work with. And when they give feedback about what you do and how you do and what the experience of you is, and then you take a really deep dive and reflect on that, it can help you develop a style, that is more effective. Uh, so whenever you think about your leadership, the questions I feel that you should ask yourself is, what is going to be your legacy after you've left? So, um, before you came into that role, what was the effect of you? So you always try and think backwards. When you've done your stint as medical director or whatever it is, when you've done that and you've left that organization, think about what people will say about you. What was the effect of you? What did you actually do when you were there? Were you present? Did you impart your knowledge and expertise on other people? Did you create capacity? Did you offer people opportunities to grow and develop as leaders? And most importantly, how did you make people feel? So you might have been very successful, and you might have achieved a lot, but through that journey, how did people feel about you? So you've got to ask yourself those questions, before you sort of develop, a leadership style. Um, Now, I think your leadership style should always be fluid. They are, they're different. There's a time for everything. There's a time to be, reflective and inclusive. And there's a time to be firm. There's a time to be you know, I don't think it's good to be directive all the time, because actually it's quite damaging. But certainly when you show a degree of indecision, then what actually happens is that you don't steer the ship in the right direction, and then you open, the door to detractors who might, betray the overall aims that you have, as an organization or as a team. So I think, leadership has to be one where there's, a constant dance, gauge the mood, gauge the situation, and apply the principles that fit that situation more effectively. Uh, and don't be one-sided. Don't develop a reputation where, every time people come and interact with you, they expect you to respond in a certain way. Because if you do that, you become quite rigid, and then people will start to develop a workaround for you. And sometimes they won't involve you in certain situations, because they know how you're going to respond. You're probably like a one-trick pony, and you're not, you don't have that flexibility. So my way of looking at it is that actually, your leadership style should be driven by the particular scenario, the particular situation. When you're in, a COVID crisis, and you're in, a level 4 critical incident, there is no time for, dancing around the issues, and, doing, a wide-ranging, endless consultation. A decision needs to be made at that point. You can be inclusive in how you arrive at that
Mm.
decision, as long as you communicate why you're going in a certain direction. But what people really value in a crisis situation is a leader who's decisive and who is, who's compassionate, but decisive and forthright.
Mm. Um,
So they're different scenarios, but
Different
and that
scenarios.
style doesn't work all the time,
No.
because when you're not in a crisis situation, well, what's the need for you to be directive?
Mm.
You've got time to consult and be inclusive, and who knows, when you are inclusive, excuse me, when you are inclusive, some really good ideas come from within the ranks, and those are the ones that you end up adopting, and
Mm.
that's even better.
Mm. So some excellent points there by Itai. It's talking about regular feedback, fluid style, reflective versus firm versus directive, inclusive and decisive. And last but not least, waltzing with the music, which is really powerful, and I suppose that's a nice way to put it.
Mm.
There is a question here, Itai, which is quite an interesting one, which is basically asking about when individuals, when they are training, whether they're doctors or not doctors, and they experience working with a difficult so-called leader, and they, as a result of that, they do not take on or do not want to do that role because of the experience they've experienced by their own line managers. I mean, one of the things that I experienced when I was doing my SPR training, which is the senior training once you complete your exams just before you become a consultant, because I worked with a consultant who was really, really difficult, extremely difficult. The way I took it was that while I adopted and tried to learn from the good leaders or good coaches or mentors, I also learned from those who I would not like to operate like. So what's your thoughts on that? I mean, it's a question there as
Mhm.
well. But what do you think about? It's sometimes good to work with difficult people, not
Mhm.
continuously because that can be quite
Yeah.
stressful. But one can learn from bad experiences, can't they?
Yeah, absolutely. And actually, when you find yourself in a situation where there's a bad leader, who is in charge, that should motivate you even more to want to
Mm,
get to a level of influence, because what the world doesn't need is a whole bunch of bad leaders who take us into the wrong direction.
Mm.
And actually, part of the thing about when when good leaders stand aside, despots rule, and the population suffers from that situation. So I think it can take a toll on you, particularly when somebody is, quite influential. And this often happens. I mean, we've all been through it. Sometimes issues of, color and race play out in those scenarios. And what tends to happen, is that you've got the poor, registrar or SHO who then feel so demoralized and dispirited, that even their actual performance, starts to take a dip. Even their, motivation and well-being starts to take a dip.
Itai, can I
And
just
I
stop
think,
you there? I think because we haven't got long to go, and we've got a caller who's called in. So can we take a quick question if that's all right?
yeah.
Go on, Ahmed. Yes, put them on. Hello. I can't hear them. Hello. They're not transferred through. They're gone.
Hello?
Okay, they're gone. We're still here. Right, sorry, Ty, carry on. We've got just a little above 2 minutes. So if we're
Okay.
gonna before you when you're having fun, how quickly? So we're reaching 1 o'clock. We've only got about another couple of minutes. So Ty, so carry
Yeah.
on. So yeah, sorry.
So what I was saying is that, when good leaders stand aside, despots rule, and I
Mm.
think what you want to do, is to have a really good stock of good leaders. Um, I think the system should be designed to protect, doctors in training from experiencing that level of pressure. And I think, the fact that by naturally we are, when we're training junior doctors, we put them in rotations, and they get to move around, to different spaces. And as they go higher in their specialist training, the feedback that's given about certain consultants, leads those consultants to not, be preferred individuals for training rotations. Um, and I think it's right that, doctors should be able to choose, who their trainers are based on, what they want to put in their portfolio. And I'm a big believer of, that choice, because I benefited quite a lot from being in a very large training scheme where I could go to different places, and I could also do a hybrid where I could get special interest sessions from different spaces. Um, and when you are, in that sort of situation, you can then get that variety that you're looking for,
Mm.
and progress. But I would say to that doctor in training who feels really discouraged by having worked, with someone who was an ineffective and probably not a very good leader, is that get into a leadership position,
Fantastic.
and challenge that, bad practice. Because when you get into a leadership position, and you, drive quality improvement, you drive compassionate leadership, those kind of elements which are quite negative, will cease to
We've
have
come to the
traction.
end of the show, Itai. Those are really powerful messages. And you know what? I want to say a big thank you to you for giving us your time on a Sunday. I know you're a very busy man. So thank you very much. I hope you've enjoyed it as much as we have, Itai.
Yeah, it's been really good. Thank you very much for inviting me, Shahid. And
My pleasure, Itai.
um,
We're just about to close. You've been
yeah,
listening to Ramadan FM. Thank you very much. Thank you, Itai. We'll see you again.
cheers. Thanks.
Just stay there.